How does the lymphatic system contribute to reproductive cancer spread? Imagine your body's network of tiny vessels acting like highways for immune cells and fluids. The lymphatic system is a key part of this network, and it plays a big role in how reproductive cancers like testicular and cervical cancer spread. When cancer develops in the reproductive organs, cancer cells can invade nearby tissues and enter the lymphatic vessels. These vessels are responsible for draining excess fluid and immune cells from tissues, but unfortunately, they can also carry cancer cells to other parts of the body. Once inside these vessels, cancer cells travel to the first set of lymph nodes, called sentinel lymph nodes. These nodes act like checkpoints, and if they contain cancer cells, it often indicates that the disease has started to spread. From here, cancer can continue to move through the lymphatic system to other lymph nodes, and in some cases, reach distant organs. This process is called metastasis, and it is a major factor in the progression of reproductive cancers. A key process involved is lymphangiogenesis, where tumors releases growth factors like vascular endothelial growth factors, C and D. These factors stimulate the formation of new lymphatic vessels around the tumor and in nearby lymph nodes. More vessels mean more routes for cancer cells to escape and spread. Studies have shown that increased lymphangiogenesis is linked to higher chances of lymph node metastasis and worse outcomes in cancers like cervical cancer. Cancer cells also use chemokine signals to guide their movement. They express receptors such as CCR7, which respond to chemokines like CCL21 produced by lymphatic endothelial cells. These signals act like a GPS, guiding tumor cells toward lymphatic vessels. The flow of interstitial fluid around tumors further enhances this migration by shaping chemokine gradients and activating signaling pathways that encourage tumor cells to move toward the lymphatics. When cancer cells reach lymph nodes, they can evade the immune system by exploiting mechanisms within the lymphatic environment. Lymphatic endothelial cells can suppress immune responses, making it easier for tumor cells to survive and grow within lymph nodes. This immune evasion helps the cancer establish a foothold in new locations. While lymph node involvement is often a step toward distant metastasis, recent research suggests that some metastases can occur independently through the bloodstream. This means that lymphatic spread is a major route for reproductive cancer dissemination, but not the only one. The presence of cancer in regional lymph nodes is a critical factor in prognosis and influences treatment options, such as whether to perform lymph node removal. Understanding how the lymphatic system interacts with tumor cells helps doctors develop better strategies to block cancer spread. Treatments may aim to inhibit lymphangiogenesis or chemokine signaling, reducing the chances of cancer cells traveling through the lymphatic system. Always remember, individual cases vary and personalized medical advice is essential. If you or someone you know is facing reproductive cancer, consulting healthcare professionals is the best step to understand the specific situation and available options.